Hi, I'm Dr. Haridarshan. I'm a consultant in general, laser and laparoscopic surgeon associated with Pristine Care who caters to a seamless surgical experience. In the present era, with an altered lifestyle, stress, lot of traveling and or disturbed sleep and lot of tension in life, people encounter a lot of problems. One of the most common problems are the perianal diseases, which can be called as the bottom problems in layman's terminology. So, what are these problems? So, the most common perianal or the bottom problems that are encountered are piles, fissure, and fistula. Today, I would like to just give you a brief idea about what is piles. Piles is basically a layman's terminology. In medical term, it's also called as hemorrhoids. It's called in different terms in different languages. It's called as Moola Vyadhi in Kannada especially, and Bavasi in Hindi. So what are these piles exactly? So coming to the anatomical part of hemorrhoids, there is something called as anal cushions within the anal opening. So these anal cushions are generally about 3 to 4 centimeters within the anal canal, which cannot be seen but can be felt. These anal cushions are normally present in all individuals, which helps to maintain the tone and the smooth passage of stools. So these anal cushions are basically helps in maintaining the tone of the anal canal and the smooth passage of stools. Now, these anal cushions are present circumferentially or 360 degrees around the anal canal, and it's got blood supply from all over. So what happens is, especially in some conditions like constipation, pregnancy, hard food, low fiber intake, less water intake, and obesity, these kind of the things basically increases the pressure on these anal canals. So when the pressure increases on these anal canals, this anal canal starts popping out from inside, and from inside it starts coming out. So based on the size of the anal canal which is coming out, the piles is graded as grade 1, grade 2, grade 3 and grade 4. So what are these grades 1, 2, 3 and 4? Grade 1 is basically the bleeding which happens because of increased pressure from inside. Grade 2 is the anal cushions which is protruding out, but it automatically goes inside. Grade 3 is this pile mass which comes outside but refuses to go inside by itself, so we need to push it so it goes inside. And finally, grade 4 is where the pile mass continues to remain outside and it does not go inside even while pushing it. So these are the 4 grades of hemorrhoids. So because these anal cushions have got blood supply, the hemorrhoidal mass which protrudes out, the blood vessels within that starts to become thin and starts to become dilated and elongated. So because of increased pressure, one of these blood vessels can open up and can cause bleeding. So now the patient asks, like, sir, you told me what is piles, but what are the symptoms? So the normal symptoms what you can get in hemorrhoids is first bleeding, which is painless. Then the patient can have a mass protruding out of their anal region, and in long-standing stages, and if the piles is very big, then the patient can have pain as well. So initially painless bleeding, mass per rectum, and finally the patient can have pain and a big mass. So these are the symptoms of hemorrhoids. So what do we do about it? So there are different types of treatments for hemorrhoids. What we can say is, one is medical treatment and the other one is a surgical treatment. So medical treatment is basically some ointments or painkillers or some tablets which are given to reduce the bleeding and to reduce the size of the hemorrhoidal mass or size of the piles. So it could be allopathic, Ayurvedic or homeopathic. These things are good just to control the symptoms, but the cause remains even with these kind of treatment. So the medical treatment was what we call as a temporary treatment. Now patient looks at a permanent cure. So what are the permanent options for this? It's a surgical procedure. Now surgical procedure, there's something called as an open procedure, there's something called as the laser procedure, and other one is called as the stapled procedure. So open procedure is the one which has been conventionally been doing for centuries, where under anesthesia the patient, the hemorrhoidal mass is seen and it's cut, the mass is removed, and then a couple of stitches are put and the pile mass is taken off. So this is a good procedure, but the thing is, with this open procedure, there's a cut. Because of cut, there is dressing which has to be done, and because of the cut, there can be bleeding, and because there's cut and bleeding and dressing, the patient can have pain. Now what happens is, with this pain and the cut will take at least about 1 or 2 weeks to settle down, and then the complete recovery takes about 2 to 3 weeks. So the problem with this is the recovery time is longer, and the patient needs to take long rest, and they need to have a lot of time before they get back to work. And for the first 1 week or 10 days, patient will probably also have a problem in sitting. But the most important problem that can happen in an open surgery is recurrence. Recurrence is, in spite of doing the best of open surgery, the hemorrhoids coming back, the chances is at least about 30 to 40%. So this is something which has to be tackled. So what we do in Pristine Care, as I initially told you, it's a seamless surgical experience. So we try to do the hemorrhoids and by laser procedure. So I won't say it's a surgical procedure, it's a laser procedure, because in laser procedure, unlike open surgery, we do not have any cuts. Because there's no cut, there's no bleeding. And because there's no bleeding, there's no need of dressing. And because there's no cut, no bleeding and dressing, the pain is almost negligible and or very minimal.